with your hand, looking right at my nose. I'm going to flash fingers. You tell me how many you see.
1, 2, 2, 1.
Okay, open your mouth real wide. Say ah.
Ah.
Relax your arms. I'm going to passively move your arms. Put your arms up like your arms out like this. Pull towards you. Up. Straighten this leg for me. Straighten this leg for me. Great.
Your left-handed dominant. So we'll do your left hand first. The sequence of which way you do this, you'll go top left-hand corner, go across, drop the table to turn them over, nor turn your palm towards the ceiling when you do it. Make sure you don't use the little, when you're picking them, don't use that part of the table at all. You actually have to spin it inside your hand.
How you're feeling right now, and then after that you go into different, and probably, so just click on one of 4 numbers appear on the screen. If you see a 2 or a 3 appear on the screen, then you click on the 2 or 3 button. When you want to be fast and accurate.
Mild traumatic brain injury occurs when someone has been exposed to either a blunt force or a blast injury to the head. And what happens is the brain lives in a skull, which is a hard box, and it is unforgiving. And the brain shakes around, and there can be micro damage to the brain. And that can result in lots of symptoms, the most common being headache. I think it's no surprise that the weapon of choice by the insurgents is the IED. And unfortunately, many of our soldiers and Marines are being exposed to blast injuries every day. And so the number of concussions are increasing dramatically as the activity in the South increases. So we are unfortunately very busy down here. We will obtain an accurate history to the best of our ability. And then we will do a quick exam and determine whether there's an abnormality on exam or not, and that will help determine whether we need to obtain brain imaging like a CAT scan. And if there's an abnormality on a CAT scan, then the patient may need to be referred to the neurosurgeon. If the CAT scan is normal, they'll be referred to me, and then we will again examine them and then treat their symptoms, and we'll follow up with them here for a period of several days up till about a month to see that they get resolution of their symptoms. Unfortunately, not everybody gets resolution of their symptoms, and if they don't, then we will send them back home.
Okay.
We treat the symptoms generally with various medications. So for headaches, we treat with typical analgesic medications. Patients with TBI often suffer from insomnia, so we need to treat them with medications to help them to sleep. They also develop nausea and vomiting, so we'll again treat them with medications to prevent that. And then if they have balance problems or strength problems, we'll send them to our therapist to help work with them in physical and occupational therapy. Also, some patients will have emotional problems, and we'll send them to combat stress or to our neuropsychologist or psychiatry. If a soldier or service member has received 3 concussions within the past 12 months, they're mandated to come and be evaluated by the TBI team. And that includes myself, the neuropsychologist, and the occupational or physical therapist.
The amount of mild traumatic brain injury we've seen has increased, and a lot of that has to do with the increased activity in Kandahar. I think what's important to emphasize is that TBI is a real phenomenon, but the majority of people get better. It's not something that's career-ending generally, but we do know that the more traumatic brain injury you have, the sometimes longer it takes you to get better. And we're here to help support those patients as they go through their symptoms and hopefully get them home or get them back to duty faster or sooner rather than later. The grand majority of patients feel better within 2 weeks. And that's probably generous. We do see patients that we will keep here on CAF for up to 4 weeks, really, before we think maybe it's going to take a little bit longer than that. But the majority of patients, I'd say, between 10 days and 14 days.